First of all, I would like to welcome Dr. M. Cyril to this interview with the topper. And I would like to congratulate you for your wonderful rank in your INS super specialty examination. I've been told that you have achieved AML rank 1 and CML rank 1 both. And that is a remarkable achievement. So, congratulations.
Sir, good morning, sir. Thanks a lot. Thanks a lot for your wonderful words. Like it's like a dream come true. To have a chat with you. I have heard about you in my like MS times. So like it's like a
Okay.
very like good to have a chat with you, sir.
It's wonderful to have a chat with you. So I'll be just asking you a few questions that might help our other students to prepare for the INS super specialty examinations, and
Yes, sir.
I won't take much of your time.
Sir, no,
So
sir. Yeah. I'm sorry to
yeah,
take your time actually.
no,
Uh,
no. So first of all, the first question is where are you planning to go now? So you have got first rank in your All India Institute of Medical Sciences in New Delhi, and the other top institutes that are included in the INS super specialty examination as well, right?
yes, sir.
Right. So do you have a decision in mind where you want to go?
Sir, yes, sir. Initially, I had done my undergraduation from JIPMER, sir, from
Okay.
Pondicherry. And
Okay.
during that time I had given PG exam. So at that time also I had the same confusion whether to
Right.
join which institute, JIPMER, AIIMS or PGI at that time during
Right.
my NEET PG. So at that time one of my consultants from surgery, Dr. Sudarshan sir, he had encouraged me to come to AIIMS because to have a
Right.
wide range of exposure and everything. So because of him,
Right.
even though my parents were little not very favoring for me to come to AIIMS. They had told me
Right.
to go, and they were supportive, sir. Parents and my consultant was supportive. And because of
Right.
that, I came to AIIMS New Delhi, and I have been happy, sir, here. And same decision I have to make now. I am currently going to stay in AIIMS. Only, sir, AIIMS.
Okay.
AIIMS.
So you your MS from AIMS as well.
Yes, sir. Yes, sir.
Which unit were you in?
Sir, I was in Unit 1, sir, Unit 1, but later
Okay.
now it has been divided into 1 and 6, so I belong to 6. So I have both worked under Chumbar sir and Anita ma'am, basically.
Okay. Okay. And you plan to continue your super specialty course in AIMS only.
Yes, sir, yes, sir.
Okay. And can you tell me how did you prepare for your entrance examination? I'm sure being at AIMS, you must already have an exposure of the super specialty streams that you wanted to get into. And did that help you in preparing for the super specialty examination? Because I have met some candidates who feel that they don't get adequate exposure to the super specialty streams in their MS, general surgery. And
Okay.
that has prevented them from opting for a super specialty course altogether.
Okay, sir. Sir, actually, urology is itself a very different subject from rest of the like surgical branches. If we see, it is both
Right,
medical and surgical. And as far as I have heard from my friends, during
right,
masters we don't get that much exposure to urology. But
right,
here in AIIMS New Delhi, we have a very good rotation so that we get posted in other super specialty departments. So
right,
one of my biggest support was my for exam, like for subject per se, my senior who is here, who is a senior from JIPMER, Kevin sir,
right,
he was very inspiration for me.
right,
We used to talk a lot about what is going on in the department, what cases, some interesting cases he will show, interesting
right,
photos, other things he used
right,
to give. As
right,
for the exam per se, my mother used to help me a lot, sir. Actually,
right,
I had decided that I will start from second year, but due to
right,
some of my personal reason, I couldn't study during the second year, sir, due
right,
to some personal issues. But during third year, I was last time July exam. I had MS. I had my MS exams. So during
right,
that time, I called my mother here to stay with me so that I will read properly. So
right.
he came for 1 month. She was with me, and
Okay,
at that time, actually, I was planning to go back to JIPMER during
right,
that time. So at that
right,
time, once it had been released last time.
right,
So during that time, I had my MS exams also simultaneously. So at that time, I had planned that only 20 days I will study urology. Only urology I will study, and I will
right,
give the exam, and I will see my first notion was to understand the question and understand the MCQs, like whether I'm reading from a right
correct
source or
source.
whether
Right,
yes, sir. So at that time I had got my Marrow subscription, and for MS exams also it has helped me with other subjects because
right,
in Marrow we get all the subjects. So that is one
Right.
advantage of subscribing. So at that time, I had used it for both my MS exams as well, sir, some of the notes. And
Right.
urology per se, I had watched only the videos and I have made my notes.
Right.
And whatever, like initial video, how to prepare for urology, one of your video is there, sir. So
Right.
like tier one, tier two. So at that time, I had concentrated on tier one as far as possible, and tier some
Right.
of the tier some topics I had to leave it because I didn't have much time. So at
Right.
that time, I had done videos and I have made my notes. And on top of that,
Right.
I used some Q banks and MCQs and add the
Right.
points in that same note, sir. Because like when we are revising it, it
Right.
is difficult to accumulate and read from other places. Like if you have written it like other places.
Right.
So and doing that, I had divided my days, sir. 70%, 30%. 70%
Right.
days of time I'll make a schedule. I will read whatever possible. Then like last 4 5 days I will revise whatever I have read. So
Right.
basically, I had done almost 1.5 times last time, and I gave, but by 2 marks I couldn't qualify. Last time
Okay.
they were told that it was a difficult paper because I was giving it for the first time. I didn't have much idea, but
Right.
as far as I remember, almost 80 questions I understood. I
Right.
understood what they are trying to ask, and I was able to make some decision, but I couldn't recall much because I had read it in a short time. So this time, same
Right.
like in between, I had my SR exam. I am working here as senior resident sir now as non-acad in
Okay.
Department of. So at that time, I had planned that I will read some general surgery, so that I will read and give
Right.
the senior residency exam in between. And
Right.
after my MRCS got over, MRCS part A I had given in September. So after
Okay.
that, I had around 2 months, I think, sir. 2 months, yes, 2.5 months I
Okay.
had. So same
Okay.
thing, sir. I had made a schedule. I had divided it into 60/40 or 70/30 like that. So this time
Okay.
I was very sure not to make silly mistakes because last time because of my silly mistake I couldn't qualify by like very close margin because last time only 2 3 questions. If some silly mistakes I would have avoided, like it would have been better.
Right.
So this time I was very conscious that I will avoid the silly mistakes and I will
Right.
just focus like on revision. So
Right.
same, sir. I had used the same material. So
Right.
same whatever I had done last time. This time I used I used to have some color pens and highlighters as you have told in the video. So it
Right.
was like something like that, sir. So I had
So
followed that.
yeah.
And,
So do you
and
feel that just the MRO videos were sufficient, or do you feel that doing the textbook is also important, or do you feel a combined approach for the important topics you do the textbook and the videos, and for the topics that are little less important for the entrance examination you do only the videos and you can leave the textbook? What is your approach like?
sir, my approach was only videos and notes, sir. But my seniors had told that you at least read Euro Oncology from Campbell. But
Right,
I didn't want to digress from whatever I had put efforts into the notes
right.
and videos and whatever additional point I have added. So my
And the
basic
videos you found were sufficient.
yes, sir, it was sufficient. That's why, like,
Right,
I read from a very limited this thing, sir, and I revise it. I revise
right,
2 times or 3 times. Some chapters I had from notes I have read 3 times, and some of them 2 times. Minimum 2 times I would have read, sir. This time,
right.
so total combined last time and this time around 3 4 times I would have read my notes.
So
And
for the yeah, sorry.
regularly I used to put Q banks and MCQs, sir. So that is what like it is like just a reflex that stores in your brain or like something like that. Because in the exam there is no direct repeats. Direct repeats maybe 15 20 questions you can get a direct
Right,
repeats. Other
right,
than that, it is basically your instinct and whatever you had read and whatever you are like basic the
right,
basics that be clear and like it will help you eliminate options and like
right. But eliminating options helps you a lot, I feel. If you're
yes sir,
able to
yes sir.
eliminate options, then you are able to increase your probability of getting a right answer.
Yes, sir. Yes, sir. So in
Yeah,
some doubtful question, I used to do that, and very like some silly mistakes. I like very particularly this time. I was very focused on silly mistakes, sir.
right.
Because last time
And
I
do
had
you feel that for revision, you made use of the high yield revision video, or you used to refer to a question bank and your notes for the
sir
final
actually
revision?
high yield. I had used I think this chapter, sir. I think urology part that UDS and all I had read,
Okay.
but I saw the notes, sir. I saw the notes of high yield this thing. high yield videos. I think it is sufficient for revision, sir. But
Okay.
as I told, like I am very
You
focused
already
on.
have your notes.
Yes, sir. Notes and just revise it again. Like from
Right.
whatever place you read or this thing, you should have your notes and we should revise it again. So I had seen the notes. Since it was new to me, I couldn't like sit and write it last time, like last minute. So I had just seen that and some additional points. Like I think in prostate, you had put a flowchart in high heel videos for
Right.
that
Right.
latest
Those are from
guidelines.
the guidelines.
Ah,
One
yes, sir.
student had asked me to put the notes from the EAU guidelines, so I placed them for the
Yes, sir.
IIT.
That flowchart I had seen, sir, for prostate, and one question had come from that.
Acha.
So,
Okay.
I
Okay.
had
Okay.
I was feeling happy that okay guidelines. I actually downloaded the guidelines, but obviously I couldn't read or understand what was written in that. Some boxes,
Right.
some holes was there, so
Right. Right.
couldn't.
Okay. And so for the INS super specialty, only urology is sufficient. There is no general surgery in the entrance examination.
General surgery, 30 questions was there, sir. Same
30
like
questions
last
there. So how
30
did you
questions.
prepare for that?
Sir, initially, actually, during my senior residency, I had read some parts of it, and
Okay. For the videos.
sir, videos. This time, I read some breast endocrine and some breast endocrine and basic that, sir, starting nutrition and trauma.
From the
Uh,
textbook.
no, sir, from the videos and the notes, like Marrow notes. I
From
had
the
for
video.
PG also, I had
Right.
used the same
Okay.
same notes, so I had just
Okay.
revised it, and then but
Okay.
what had happened was I had kept some 2 3 days in between to put
Right.
some maximum GTs as possible in
Right.
from surgery, so that whatever high yield areas that GTs they had focused. With that only,
Right.
I was like confident that in general surgery I'll be able to score. But because urology makes a major chunk of it, you should be clear on urology, sir. Because general surgery is very vast, as far as
Right.
I, and they can ask you from anywhere, anything.
Right.
So
Better to focus on urology if you want to score high.
focus, yes, sir. Main focus, like your 70%, 80% of your time should be on urology, sir. I feel because that
Okay.
urology 50 questions is in your hands. Because urology,
Right.
there are specific topics, specific subtopics that you have to concentrate and read and revise it. But general
Right.
surgery is quite vast. But basics you should be like knowing, sir. Like critical care, nutrition, and like breast
Right.
endocrine parts. Like in AIIMS, they like mostly ask breast endocrine parts. So
Yes.
like to revise general
Yeah, so for
surgery,
general surgery,
main important.
basically, the general surgery thing is very vast. So, what is important is to be well read in the whole general surgery, as you will be in your MS exit, and the basic general surgery point you should be aware of, because subspecialty in general surgery probably they won't ask also. They'll
Yes,
probably
sir.
more interested in the general surgery and the super specialty that you have chosen for
Yes, sir.
in the entrance. Right.
Uh,
So I'll just have two more questions. One is that what was your frequency of giving mock tests, and how did you approach them? Like, did you make sure that your rank in the mock test, rank test used to be high? Because somehow I feel that the rank that you get in the mock test reflects in your final rank.
Yes, sir, definitely, sir. It will reflect in the final rank. The thing is, sir, as far as I had read the like I had initially watched the videos and read my notes for that chapter. I will do the
Right.
Q bank and the test, all the test like Q bank and the
Together.
chapter wise test together only. I will add extra points in that note, sir. So
Okay.
towards the last days of my exam, like 10 days or 10 days or so, I used to give daily one exam, sir. Daily one urology exam I will give,
Right.
even however old it might be, some subject test, some mock test, some grant test I used to give, and I used to test my revision whether I am doing it adequately, where am I missing, what am I forgetting, which
Right.
important part I am forgetting, and also
Right.
to avoid silly mistakes, sir. And obviously mock test will be
And to
amalgamation of
time it also.
I said to time it. I usually finish it within I think 40 minutes, 50 minutes, like
Right.
that.
Once
I
since those
once
cheats
like
have gone away, timing has become a little less important, I feel.
yes,
Because
sir, yes, sir,
earlier we used to
definitely.
circle that, so that used to take a lot of time, and a lot
Yes,
of
sir.
students were not able to complete the question. But
Okay,
now
yes,
with clicking and with the computerized system, obviously it has become
yes, sir,
easier.
yes, sir. Definitely, sir.
Yeah.
Definitely. In my first go, I used to answer whatever I was very sure. Like this is the
Right.
answer. So I
Right.
used to fill it, and I used to leave the. This time also I had done the same.
Right.
Left some 15 questions, 15 to 18 questions I had left. I had some doubts. So I
Right.
went back again. Almost two times I had seen the questions, all the questions, sir. So when I
Right.
went back, I had some questions I had like doubt, some 10 questions I had doubt like whether this option or that option, and rest
Right.
five questions I just guessed using logic or something, sir. So I had attended 80 questions.
Questions in which you had doubt, did you change the answers? Do you feel that the instinctual answer is better, or
Sir,
the
no, sir,
answer
no, sir.
that you give
Actually,
after
no, no,
thinking
sir.
is better?
No, sir. This my especially my mom told that whatever you had selected it first, you just let it be. And if you
Right.
go and probe it again and again, you will create a false memory, false something, something, and then you will obviously answer something wrong.
Right.
So
So the
I
first answer
usually
is the best answer, I feel.
first answer is the best answer, and before changing the answer, you make sure that the question is right. Because this
Right.
time it happened to me twice that once I think for emphysematous emphysematous kidney was asked, sir.
Okay.
Yes. That thing has asked, and in the stem they had given one side nephrectomy was done. So that I
Right.
had missed it during like my fast reading of the question because question was little big. But when I
Right.
was choosing the answer, because in grading question and all, they will give some keywords, sir, basically.
Right.
So I
Right.
was about to choose the grade, and when I went back, I saw that already one side it has been done. So bilateral will
You
come for
cannot
the
do that
yes,
in
sir. So
effectuation.
uh,
Right.
that is very important, sir. So
That's true.
that two three questions I had changed this time because I had read the question wrong.
Right. Okay.
So
And finally, I would like to ask you for some closing statements on how to prepare for the students who are preparing for the INS super specialty. Some bullet points that you can give, three or four bullet points, maybe, that these are the most important points while preparing for any entrance examination.
okay, sir. Actually, bullet points for me personally. My mother was a big support to me, sir. She was
Okay.
encouraging me throughout. She always used to tell that I will get Air one, Air one, Air one. Like Air initially, we had All India rank, so
Right.
she used to always tell that I will get because by seeing the effort she had put because she was staying with me. So always
Right.
parents will encourage their child for betterment of them. So we should first listen to parents. So parents should be encouraging to a person when somebody is preparing, sir, because preparation is a very hardship that you go to. It's a mental stress and everything. So it's like very you need a very good supportive ground, sir. So I had a very supportive
Right.
ground of my parents, my seniors, my colleagues who had helped me with my duties and everything. Second thing is that the student should have the mindset that he can crack this exam if he puts the effort, if he studies, if he does smart work, like smart work
Right.
along with some hard work. Like you can't be very lethargic and you will see that I will revise, then you leave it and go. That it's not the thing. So you should have the mindset for the exam. First is support, then mindset, then the key is revision, sir. Like you tailor make whatever plan suits for you. My plan was I used to write down all the heading in the board, sir. I have a board, so I used to write all the headings and I used to put by date, by this date or in 2 days 3 days I will finish this topic and then I will go back. So for initial studying also I had a timetable. For later part of the study also I clubbed some topics so that it won't be like difficult to revise it later. So I had made a schedule. So you make a schedule, you stick on to it as much as possible, because like we tend to digress from the topic. We get to get lost when we read it. For example, if we are reading prostate is very vast and surgical aspects, everything is so nicely done by you, sir. Like nicely explained, everything is there. But during that stipulated time, if you have to finish that the topic, you have to finish the topic. You can't be sitting and reading because like we will miss out other topics. So because of that, I followed the schedule.
Right.
And next GTs, sir. GTs, I as I remember from my PG days, they tell that when should I you have like started GTs is yesterday. So basically that you should be regularly putting MCQs, regularly solving Q banks and everything, and add the notes, add the extra points to your notes so that it will help you in revision. And I had done MCQ like 2 times, or almost 2 times, entire Q bank and test everything I had done 2 times. And main is after putting GTs, you have to see which part you are making mistake, and you should like revise that part better and understand the basic better, so that you
Right.
don't repeat the mistake. Basically, repeating a mistake is like it's. I feel that it is
Losing a
like
point, basically.
yes, sir, losing upon the competition, and it's not something like aspirant or a competitor should be like should avoid such repeat mistakes. So I
Right.
was very conscious
Well
in
said.
mistakes and repeat mistakes so that I don't get out of the race.
Right. So I feel that the points that you have said are very pertinent, and Well said, and I congratulate you again for cracking the INS super specialty entrance examination. I welcome you to the AIIMS community once again. And
Thanks a
I
lot, sir.
feel
Thanks a lot.
that hard work and dedication, along with some smart learning and revision, and being mindful during the examination and using common sense goes a long way in cracking
Yes.
these examinations. So thank you once again, Dr. Cyril,
Yeah,
and
thanks a lot,
let's
sir.
hope we
Thank you.
meet soon in a conference or
Sir,
somewhere.
definitely, sir. I have heard from my seniors. I will definitely meet you, sir.